Sa wastong kalusugan, narito sina Dr. Cecil Katapang at Ryan George dito lang sa Klinika On Air.
Hindi ko naririnig yung sila. Good evening. Natatawa ako dun sa booth kasi sabi niya, Good evening everyone. Welcome to Klinika On Air Thursday edition. And we have a very special guest tonight. All the way from Tomas Morato.
San Diego.
Your clinic is just at Tomas Morato, right?
Oo. Very malapit dito.
Oh, magaling pala magtagalog. Buti na lang. Hindi ako duduguin dito. So, anyway, since I was not able to get some details regarding your background, I will just introduce you as Doc Rob. What your family name is?
Dr. Robert Walcher.
Okay, Dr. Robert Walcher of Doc Rob Chiropractic Wellness Clinic.
Oo.
Ayan. So, and of course, the wife, no other than, siyempre, no, everybody knows her, is Patricia Javier. Good evening.
Good evening po sa iyo, lahat ng mga listener. At syempre sa iyo, Doc. Napakaganda niyo pa pala in person.
Yes, maganda ka. Thank you very much for gracing our today's show. Okay?
Yes, so, it's our pleasure.
First, I'd like to ask, what is chiropractic medicine? Because I've been wanting, actually, to try it out.
Yes. Great question. A chiropractor is a doctor that basically cares for one's spine. Okay, so it's so important to care for our spine. Our spine basically allows our body to move properly, our joints, our vertebra, pelvis, knees, ankles, elbows, shoulders. But it also houses a very, very important organ called your central nervous system. So as we go through every single day, stress accumulates on our spine, and our spine misaligns. We develop subluxations, and that affects the joint, and it affects the nerve function.
Okay. Because when I was researching for my Facebook post, I saw that chiropractic medicine is a form, or chiropractic, that's a term, right?
Chiropractic.
Chiropractic is a form of alternative medicine where what do you call this? Where the treatments are undiagnosed medical cases, something like that. I cannot recall but it has something to do with. Wait, let me just check. When I posted it, so I searched it in Wikipedia, and this the definition was a form of alternative medicine involving the diagnosis and treatment of unverified diseases of the musculoskeletal system, specifically the spine. So when you say unverified, that means to say you don't need x-rays?
You don't. X-rays are a great tool, but you don't need X-ray. You don't need MRI. But those things do play a role, and they're important to be extremely specific, yes, with the joints.
So for example, how does one, for example, patient comes in, so how do you start without any workup?
Well, we do a thorough history. Okay, we do an evaluation, and a chiropractor, I've been practicing for 15 years, and I took 15 years of x-ray in my practice in San Diego. And so here in the Philippines, I'm currently not taking x-ray, but you can tell a lot just through the history. You can tell everything I need to know through the history. A person's age, their symptoms.
And their work.
Yeah, all of those factors come into play of their spinal health.
Okay. So, for example, a patient comes into your clinic, for example, a teacher. So how do you go about the history taking, the first complaint is usually what?
Headaches,
the most common
pain,
complaint of a patient that comes into your clinic.
Headaches, low back pain, numbness in the hands, numbness in the toes, vertigo, allergies, things like that. So people come to me with all kinds of different ailments. And chiropractors, what we do is we don't treat actually any symptoms. We don't cure anything. What a chiropractor does is we improve the spinal health, which improves the nerve function, and your body heals.
So how do you improve spinal health?
Okay, so
as a chiropractor.
Yeah, so our spine comes out of alignment at an actually very, very early age. Our pelvis shifts out of place. Our cervical spine straightens and goes forward. We call that a hypolordosis. It's very common among youth, especially now with texting and video games, sleeping habits.
I'm sure you're getting a lot of patients because of this technology thing.
Marami. So that causes the joints to be out of alignment. So a joint, in order for the vertebra to receive nutrition, it needs motion. So a joint left not moving properly, it is going to create wear and tear, and that is going to affect the nerve, causing the symptom. And so a chiropractor, by realigning the spine, by restoring motion, we're allowing nutrition to get into the joint, synovial fluid, and allow the joint to be hydrated, allow the disc to stay healthy. The disc is cartilage in between the vertebra, and without proper motion, that is what deteriorates. That is called arthritis. That's why we get shorter as we get older. As we age, our joints are trying to fuse. That is arthritis.
How do you go about the treatment? When you talk about keeping the health of or bringing back the health of the spine,
yeah.
So how do
we do that?
Yeah, because what I know about chiropractors is just you manipulate the bones.
So we find these vertebrae that are out of alignment. For example, we were talking about the neck. We lose the nice curvature here. We're supposed to have a curve in our neck. We lose that. And so what a chiropractor is going to do is I'm going to gently realign. I'm going to gently restore motion to the vertebra with my hands.
Yes.
And it takes a series of times. It takes many months to actually restore the proper curvature. It doesn't just happen in one session. It takes many sessions.
Going to a chiropractor for a treatment does not mean that it is done in one treatment.
No.
It's a series of treatments.
To do it right. Of course, you can go once or twice and get some temporary pain relief, but that's not going to fix the problem.
Usually, how many sessions?
Depends on the age and the person's health. So somebody that comes to me at 50, of course, it's going to take many months to make a significant change. Now, that doesn't mean it's going to take many months to feel better. I can get you to feel better in a few sessions, but your symptoms will probably come back in 1 month, in 3 months, and 6 months. So I urge people to really think about committing to 3 months, 6 months of care. Let's get your spine healthy again. And that will actually have a positive impact on your quality of life. You'll prevent problems.
Oh, so it usually takes about 3 months for them to really
get one spine healthy again. It takes many months because you have to understand this took every single day of your life accumulated stress.
Proper posture.
Think about every single day, sleeping on your stomach, carrying your bag, crossing your legs, everything you did as a child, everything leading up, stress is accumulated. And so to do it right, to get your spine healthy, it takes time in order to do that.
But you do not prescribe like braces and things like that.
No.
Recommend to patients braces and nothing. It's all manipulation.
It's adjusting
by
the spine, chiropractic. It's not physical therapy modalities. It is just adjusting. That's true chiropractic, adjusting the spine so the nerve functions properly.
Okay, so essentially you're aligning the spine again, in its proper curvature.
Yes, proper position.
So and to probably eliminate the pinching of the nerves.
Yeah.
So how do you treat arthritis then by using chiropractor?
Okay, so it depends on if you're talking about like osteoarthritis, degenerative joint disease. So why I was kind of referring to that earlier. When the joint is out of alignment, it is unable to move. So a joint, for it to stay healthy, needs motion.
Yeah.
So over 10 years, 15 years of a lack of motion, the joint decays. So again, what I do is by restoring motion, we're allowing synovial fluid to get into the joint and keep the joint hydrated and healthy, the disc healthy. So that's how we slow arthritis with regular chiropractic care.
But as you grow older, you start to because of degenerative changes, what do you call this? The ligament, the patella, what do you call
the knee,
the patella of the knee shrinks as well, right? As you grow,
the patella, you're talking about like meniscus and cartilage.
Cartilages,
That's wear and
tear. The
tear.
cartilages of the joints deteriorate or degenerate or to a certain atrophy.
Well, not really atrophy. They can lose their hydration. They can start to get thin. They can deteriorate. That is arthritis.
So how does chiropractic medicine come in the management of this?
Well, I kind of spoke about that with the vertebrae. If you want to talk about the knee, for example, we oftentimes, why is it we develop knee arthritis? Usually in just like one knee. Well, the reason oftentimes is because our pelvis is out of alignment. So as our pelvis rotates back, it creates a long leg and a short leg. And so we're walking around with this unequal weight over the years, and that leads to wear and tear in one knee more than the other. That is arthritis developing in the knee. So a chiropractor, we don't really even touch the knee. All I do is by realigning the pelvis, allow proper balance.
So that means to say you do not address the knee, you address the pelvis.
If the knee needs it, if it's subluxated, if it's out of alignment, but usually it's not, it just needs to be realigned the pelvis and the lumbar spine.
Oh. So unlike
Same thing with frozen shoulder issues. Oftentimes is because the thoracic.
unlike the usual the usual orthopedic usual
Treating the
treatment
symptom.
done by orthopedic surgeons or other forms of medicine, they usually would address the
area of
knee
complaint.
itself.
Yes.
But in chiropractic,
It's very different.
Yes,
We
it
don't focus on where you're complaining. We try to really focus on the alignment of the body. Think of it like this: if your car is out of alignment and you're driving, it's going to veer off to the side, and
Yes.
your tires wear unevenly, your brakes wear unevenly.
Yes.
If you continue to change the tires, are
That's
you
why.
fixing the problem? No.
You know.
You have to fix the alignment.
the alignment,
That's
yeah.
everything.
That's why when your tires are worn down, the some areas are thinned out, some areas are not.
Yeah, and usually one side is worse than the other, and that's kind of what happens to our knees and our ankles and our elbows and shoulders.
And the way that chiropractors manage problems of the musculoskeletal system is by addressing the source,
Spinal
the
misalignment.
most likely source of the problem, rather than the location of the pain or
Symptom.
whatever
Yes.
the symptom.
Yes.
Oh, okay. So, I heard that chiropractors manipulate the spine, right?
Yeah.
Is there any? I did also read that there are reports of uneventful cases where
You're talking like injury
yes,
or problems that have gone.
after a
Are there
chiropractor
risks?
treatment.
Right, you're asking. Well, let's talk about that. It's a great question. So in America, every doctor has to have malpractice.
Yeah, even the one that I read, the what do you call it? The complication that I read about was not in the Philippines. It's actually in the United States.
Well, yeah, that's where
So-
most chiropractors are. There.
Probably because then the practitioners are more there than here.
Oh yeah, there's only like 30 of us here. There's
Yeah.
thousands and thousands in America.
Yeah, that's why the incidence of injuries is more common in the United States.
So to address that, yeah, so every doctor has to have malpractice insurance,
Yeah.
right? Because in America, everyone likes to sue, diba?
I know.
So just to give you an idea, chiropractors have the lowest malpractice insurance of any doctor because we don't injure people. Now, every now and then, sure, there's a person that has, maybe they have some health concerns. Maybe they're not so healthy. One in every 10 years, you'll hear of a patient that had a stroke at a chiropractor's office. Okay, you've heard of that, at a person going to a hair salon and they have a stroke. So it's not that necessarily that particular profession caused the stroke.
Yeah.
It was actually like a coincidence that they were at that.
But this particular thing that I read about is that after manipulation by the chiropractor of the neck area, the patient started to be started to experience paralysis or numbness, and then eventually, apparently, the patient became paralyzed.
Yeah.
So,
I can't comment on that. I don't know that situation, that current or that specific
But generally,
incident. But no, something like that doesn't happen. In order to injure somebody like that, to paralyze somebody, you would have to be completely negligent and not know what you're doing. That's basically like breaking somebody's neck, and that type of thing doesn't happen in chiropractic.
that's the reason. The reason why I ask that is because many are afraid to go to a chiropractor for their spinal alignment because of the fear of compressing the spinal
No.
cord after the treatment.
No.
So
It's very, very safe. It's very safe. People die every day from taking
I would not ask that.
aspirin.
I will not ask if have you had such an experience. Of course, you,
No.
you probably will not.
Actually, yung baby namin, kakapanganak pa lang, doc already checked the baby. Or even in his clinic, he treat like babies talaga.
Yeah.
Ah,
That's very good
what
for
is the common problem of infants?
Well, if a baby
they
is
warrant,
crying
treatment for?
very, crying a lot at night, not sleeping through the night, maybe not going to the bathroom, maybe getting ear infections, maybe they have a flat skull, those are all signs that they have some type of disturbance in their nervous system. They're probably misaligned. What happens usually, oftentimes, the first misalignment occurs at birth or in the womb because the child is quite compact, and the birthing process is quite traumatic. So oftentimes the atlas will come out of alignment. And so again, the flat skull, turning of the head, ear infections, those are all signs that their atlas is out of alignment. Atlas is the first vertebra. And so by gently restoring motion there, it's so simple to adjust a child. Just like an elderly person, you barely have to put pressure on their spine. And
Because the bones are still very...
Yeah, it's very delicate. You barely need any pressure. And you can really prevent problems in your child. Obviously he's going to sleep through the night. Your child will go to the bathroom regularly.
No ear infection.
No ear infections. So it's very, very good for children, elderly, pregnancy.
Okay. So, for example, does a stroke patient, would a stroke patient need a chiropractor?
No, if somebody really has a
because we're talking about
history of
nerves
strokes.
here, and
Well, stroke is different. Stroke means they've got like plaque buildup on the arterial walls, and they have, possible blockages in the arteries.
Ischemia of the brain.
Yeah, ischemia, lack of oxygen. So usually we don't adjust stroke patients. I do have some patients that are coming to me currently that have had a stroke, and I don't adjust their neck. I adjust their lower back, their middle back.
So a stroke patient would probably not...
We don't usually adjust the neck when it comes to a stroke patient.
Because when you talk about spinal health, I would think probably a stroke patient would probably be needing a restoring of a spine.
That's more of a blockage of the arteries. That's not really...
So it's actually the nerves that you're actually taking care of.
Yes, the nervous system, which controls everything in your body.
Which prevent, by aligning the bones,
we're allowing the function of the nerve.
Free flow, the free passing through of the nerves through the different holes of the bones, something like that.
Yeah.
Okay.
Yeah.
So that means that will prevent numbness of the lower...
Yeah, numbness, tingling, sharp pains. Those are all signs that there's pressure on the nerve. So we need to alleviate that pressure, and that's what chiropractic can do.
So, okay, so if a patient has all these symptoms, most likely a chiropractor will be of help to them.
Yeah, absolutely. And the great thing that I love about chiropractic is we're trying to really correct the problem. We're more or less trying to improve your quality of life. We're trying to get your spine healthy so you can live longer and feel good without living.
Exactly, because as you were saying a while ago, instead of treating the problem of the kidney, the knee, you are treating the pelvis, which seems to have been the cause of the knee problem all this time.
Yes,
they say, for example, standing on one side more often than usual, because usually you balance your weight between the two legs, but if you stand on one side more, or usually incline yourself to one side of your body, you eventually destroy the structures.
Yeah, and so I can tell your listeners some things to avoid that might be causing that pelvic misalignment. With males, it's a wallet in the back pocket.
Oh, the most common.
That's a cause of men back problems is wearing a wallet in your back pocket. So wear your wallet in your front pocket, or get one of those bags across your shoulder. So men, stop wearing your wallet in your back pocket. And females, it's the extreme crossing of the leg. Females predominantly cross one leg 80% of the time and the other one 20%. Well, okay, I'm not saying don't cross your legs, but maybe try to do 50-50 or just cross in the bottom legs.
The
ankles. And if you're aware of these things, and you make these small changes, over time they can help. But there's no way to live this perfect, unavoided. You can't avoid stress. It's always there.
Okay. Can we pause for commercial and then we'll go back to...
This is H-Ride TV.
Guys, malilibre ako! Anong choice nyo?
Choose mo to! Choose mo to!
Zesto Fruit Soda?
Refreshingly fruity because it's the only fruit soda made with real fruit juices of dalandan, calamansi, and pomelo. Gawa para sa panlasang Pinoy. Kaya choose mo to!
nyo.
Zesto Fruit Soda! Choose mo to! Zesto Fruit Soda. Choose mo to!
Uy, si Miss. Unang tingin pa lang, puti na. Kinis pa.
Nag-Myra Vita White Hand and Body Lotion kasi. May vitamin E beads and natural plant extracts that help nourish skin deep inside for a healthy white glow. Puti at kinis,
Ay!
hanggang malapitan.
Yala na.
Healthy white glow sa Myra Vita White Lotion. Yan ang alagang holistic by Myra. Trusted quality healthcare. Unilab yan.
Great things often come from humble beginnings. In 1995, AquaBest was established with the simple vision of an AquaBest store in every community. Driven by passion and commitment, and guided by its vision, AquaBest soared to be the leader in its industry. Through the years, many things has changed. New ideas flourished as AquaBest went ahead and forged new ground, reinventing the way we see and experience water through technology. From a single store, AquaBest can now be found everywhere in the country. And now, a new chapter is ready to be written. New communities and trends may come, but in the end, the vision remains the same.
Chachahin mo baby! Ang programang sagana sa mga bagong impormasyon at dagdag kaalaman sa ating kapaligiran. Naghahatid ng mahahalagang mga balita at una ang public service. Chachahin mo baby! Kasama si Jimmy Morato. Lunes hanggang Biyernes, alas 4 hanggang alas 5 ng hapon. Dito sa DZRJ 810 AM. Radio Bandido. Hatid sa inyo ng A-Try Media. Ang himpilan ng bawat Pilipino. Kasabay ng pagtilaok ng manok, mapapakinggan na ang inyong tagapanggising sa umaga, si Mr. Aksyon Oro mismo, Gani Oro. Gani Oro. Kaya't pagsapit ng alas 6 ng umaga, buksan na ang inyong radyo at itutok sa DZRJ 810 AM para mapakinggan ang ora mismong balitaan. Si Gani Oro sa Balita Oro mismo. Alas 6 hanggang alas 7 ng umaga, dito lamang sa DZRJ 810 AM, Radio Bandido. Hatid sa inyo ng A-Try Media, ang himpilan ng bawat Pilipino. Mga pangunahing balita at impormasyon na dapat ninyong malaman, mga kabulukan, pasisingawin at isisiwalat sa Lapid Fire. Makabuluhan at makatotohanang komentaryo para sa kapakanan ng bayan. Ihahatid sa inyo ni Percy Lapid. Lunes hanggang Biyernes, alas 10:30 hanggang alas 12 ng hating gabi sa Lapid Fire. Samahan si Percy Lapid dito sa DZRJ 810 AM, Radio Bandido. Hatid sa inyo ng A-Try Media, ang himpilan ng bawat Pilipino. Incorporated. Palagi ka bang stress? Nakaw! Tatanda ka niyan! Tara na! Alamin ang mga napapanahon at tunay na solusyon sa wastong kalusugan. Narito sina Dr. Cecil Katapang at Ryan George. Dito lang sa Klinika On Air.
Nagbabalik po ang Klinika On Air Thursday edition. So Doc Ram and I were talking. I was asking him if what are the chances of him working, or chiropractors working with orthopedics in the United States? Do chiropractors work with orthopedic surgeons, or are there some chiropractors?
Yeah, of course. There's times where, so for example, oftentimes a person will come in with an X-ray, and maybe we fear that they have a disc bulge. So maybe we'll refer to an ortho to get an MRI, so we can see if they have a disc bulge or a disc herniation. Sometimes, somebody has, an extremity issue that we're not helping, and maybe we'll refer to an orthopedic for help.
And vice versa.
Yeah, of course.
Can
we can work hand
orthopedic
in
surgeons
hand.
refer to you as well?
Yeah, here in the Philippines, there are not very many chiropractors, so probably most orthos just refer to physical therapists to get some form of therapy.
So they should explore the possibility of working with a chiropractor,
They should,
right?
yes, they should.
maybe we can start something like that. My
Yeah.
brother's an orthopedic
Talaga,
surgeon.
yeah.
So maybe, and your clinic is very near his clinic as well.
Uh-oh.
So, okay, here's the question.
Okay.
We know that everybody knows that you're white. Okay, so that most likely you did not take, and we do not have chiropractic courses here.
That's correct.
So the chances are you having finish your practice or education outside the country is very high.
Yes.
Or nobody would presume that you probably took it here.
Yeah.
So what about licensing?
Yeah, so chiropractors, to get in, usually you need a degree to go. So you get first your bachelor's, for example, usually in science, pre-med, or I have a degree in biology. And then you go to a specific chiropractic school, which is 4 years. It's a 4-year school. It's the equivalent to medical school.
In the
Chiropractors.
United States.
Yes, I believe there are 3 in Australia. There's 1 in Malaysia, and then there's many in the U.S. and probably a few in Europe. But chiropractic school is equivalent to medical school. We have more hours actually in majority of the subjects other than pharmacology because chiropractors don't prescribe medication. So we learn about some side effects. We do learn about some pharmacology, but the majority of ours is on diagnosis, pathology, radiology, neuroanatomy, anatomy. So we have to learn exactly how every system in your body works because we have to diagnose. Somebody comes in complaining of numbness, tingling in particular fingers or toes. We have to know exactly which nerve that is so we can adjust that.
You probably are better in the neurologic system than myself. Or the musculoskeletal. I have a question.
Yes.
What got you into chiropractic?
That's a great question.
I just wonder.
I love that question. I was 20 years old. I was a biology major.
Because you seem so passionate about your work.
Yeah, well, what's so great is
see
when
it in his face.
when you do what you love, it's not work. And this really has been my purpose and my mission since I was 20. So anyway, I'll tell
So
you.
you're 21. Oh,
I was 20 and I was a biology major, and I was always into athletics and sports, and I was thinking about going to a physical therapy school or being some type of like a sports medicine doctor. But what happened was I hurt my back one day. I was exercising and I hurt my back pretty severely. Sprain strain of the lumbar spine, but I couldn't put my shoes on. I was like, it was that
Can't bend
severe.
over.
I couldn't bend over.
Yeah.
It was quite, scary if you've never hurt
Because
your
of the
back.
pain.
Yeah, I mean, it really debilitates you when you have a back problem. It's amazing. At 20, I'd never experienced anything like that.
especially for someone into sports like you.
Yeah. And so, I said, okay, well, I'm going to go see a physical therapist. So for 2 weeks, I went and did physical therapy, and they did electric stim and ultrasound and rehab exercises, but I really wasn't getting that much better. After 2 weeks...
Everybody knows that, especially those with frozen shoulders. You go for physical therapy, nothing really happens. You feel better a few minutes and never.
Personally, I am a fan of PT. I think there's a place for it in certain joints when you need rehab of knees and elbows and shoulders, but the vertebra is a different kind of joint. And you can tell just if you look at the anatomy, it's not your typical hinge joint or ball and socket joint. It's very different. So after 2 weeks, I went to an ortho, and they prescribed some medication. Again, another week went by, not a lot better. Finally, after about 3 to 4 weeks, my dad told me to go see a chiropractor.
Why?
And I was just like you.
Does he
My dad had been going to a chiropractor.
Okay.
And I just didn't really ever think of it. And, I was just like you. I didn't know what chiropractic was. I was 20 years old, but I went to a chiropractor, and this guy told me kind of what I've been talking about, and he adjusted me. And 5 minutes later, I was like 50% better. I was blown away. I couldn't believe something that fast could make me feel so much better. And that's when I decided I was going to be a chiropractor. So I looked into chiropractic school, and there was one somewhat close in San Jose, California. So I finished up college, and then I went to chiropractic school, which was 4 years.
So is it the biology thing is a requirement before getting into, or you can from high school you can go straight to chiropractic?
No. You need many core subjects. So if you don't have a degree, well, you need anatomy, physiology, physics, OChem. So you need a lot of prerequisites to get in. So it's best to have a degree.
So it's like a pre-med and then chiropractic medicine.
So it was 8 years of schooling. So when I was 27 when I finished chiropractic school, and then I moved to San Diego and started my practice. And so, it's my passion for chiropractic has evolved throughout the years of taking care of children and kids, and I've seen so many miracles take place. I've helped probably over, I think, 3 to 5 families get pregnant. A woman wasn't able to get pregnant.
And through chiropractic.
Yes.
How do you term that? Chiropractic medicine?
Chiropractic, through chiropractic care.
Okay.
Now, I'm not saying chiropractors chiropractic care is going to fix your infertility problems. But if the problem is due to some type of interference in the nerve communicating your reproductive organs, by alleviating that interference, we can help with things like that. We've helped asthma, allergies, eyesight, hearing. Again,
Allergies? How?
Again, by clearing up the nervous system.
Okay.
But chiropractors, we don't cure any of those problems. All I do is remove nerve interference, which again allows your body to function properly.
Okay. So with proper nerve
function, your body's not supposed to be
your
in
body
pain.
functions better.
Yes.
That is basically
The pain is the warning signal. You're not supposed to be in pain. There's a problem if you have pain.
Exactly. If somebody has a lingering pain,
Yeah, and taking
there's a
meds.
problem in the nerve.
Yeah. And then taking medications oftentimes are just covering the symptom. It's never addressing the problem.
It does not actually.
Yeah. And usually causes more side effects.
Exactly.
Kidney, liver, stomach, bone density.
One of my, I know someone who has been taking non-steroidal anti-inflammatory and eventually suffered kidney
problems.
failure.
And that also diminishes bone density, leads to osteoporosis. So many side effects.
And the chiropractic medicine does not prescribe oral
So we're
medications.
trying to fix the problem, yeah.
Okay.
Yeah.
Now, in the Philippines, you know that. How did you get your license, or how were you
Yeah.
accredited
How
or
did I-
recognized in the Philippines?
So, being a chiropractor in the U.S., having an active license, that goes a long way. That means, obviously, I've gone through all of the steps. So having that is step
Right.
number one. And then I had to do many, many steps here. Obviously, just prove that, through the BIR and getting a TIN number and doing all of these things. And then I did have to apply
Department
here
of
so
Health.
that
Yes.
Department of Health. And so I've had to do many things here to get my license here in the Philippines.
so that everybody will know that you are legitimately practicing
very legitimate,
chiropractic.
yes.
Bang
I'm the
number
34th
34 siya na
chiropractor.
registered chiropractor.
So
here.
we have other
Yes.
Yeah, I know of one here in somewhere in the Scout area also.
Yeah, there are a few.
Okay, but are they Filipinos as well or foreigners as well? Would you know? Would you know? I'm just
Well,
I'm
yeah,
just
I
wondering.
too. I get adjusted. I go to a few different offices. I practice what I preach. I get adjusted. Try to get at least 2 times a month.
Okay. So whom do you go to?
I go to a guy in Green Hills. Sometimes I go to a Makati a couple times. I have a couple different guys in Makati that I see.
Are they foreigners or?
They're Filipino, maybe from here, and then
And
they
then
went to America
practice.
and then come back. There are a couple of Americans practicing here as well.
Mm-hmm.
Will somebody going for chiropractic care experience pain during the treatment?
If somebody has a lot of arthritis, if their spine is already a little bit unhealthy, certainly it might hurt
A
konti
bit.
lang, medyo sakit for a moment, and then usually, masarap.
So meron konting, there's a little pain.
Konti. Sometimes, because again, arthritis means decay. It's kind of like having a toothache.
Yeah.
So sometimes, but after 1-2 sessions, again, your body starts to get acclimated, becomes healthier, and it
What's the level of the pain when undergoing treatment? Say, for example, a frozen
Yeah.
shoulder.
yeah,
A chronic,
medyo
shoulder
lang,
pain.
maybe 3 or 4. It's not like it's like
3 or
10.
4 from 5.
Out of 10. Yeah. And that's not usual. That's if you have a very unhealthy spine. If you're 70 years old, 60 years old, and you have a lot of arthritis. But most people don't have that level of arthritis.
So which means a 70-year-old with probably osteoporosis should not be afraid in going and consulting with a chiropractor.
Well, of course, there should be always concern because you do have some brittleness, maybe of
Yes.
osteoporosis. I had a 70-year-old lady today, and actually, you just be very gentle. And as we get older, our spine actually adjusts easier, so they don't require a lot of force.
Yeah, because with Dr. Rob, every person has a different parang pressure, approach na kailangang ibigay sa patient.
Another thing I'd like to say is we talked about if it's safe and harmful. Well, chiropractic is safe, but every chiropractor is different. Their story they tell, what they believe, how much they believe in chiropractic varies. Some believe in it just for pain relief. They might just care for athletes, and they might combine PT and chiropractic and maybe recommend to only see you 6 times or 12 times and then come back when you're in pain. I'm more on what we
so
call...
it's like a specialty thing also among yourselves.
Yeah.
Like one would specialize.
They're selling chiropractic very short. Chiropractic is much more than just pain relief. So I am more of wellness-based. I believe in regular care for life as a preventative tool. So every chiro is different. It kind of depends on what you're looking for, you know.
So which means sports, those who are into sports or athletes with like yourself, who has experienced injuries.
Yeah.
Yours was a sprain?
Yeah, just a sprain strain of the joint.
And it did not go away despite physical therapy and
no.
consultation, ortho treatment, and it's just the chiropractor who was able to address that thing.
So even if you're an athlete, you might be thinking, well, then they should go see a sports chiropractor. Again, I guess it depends, and if you just want to go every now and then
what would the sports chiropractor do as compared to a wellness chiropractor such as yourself? What's the difference?
The difference is probably the length of treatment. Treatment at some offices might last an hour because you're getting the 5-minute, you're getting a 10-minute chiropractic adjustment, and you're getting maybe a 50-minute massage and physical therapy as well. Whereas my sessions are 5 to 10 minutes as more of a preventative tool, kind of like brushing your teeth. If you do it regularly, you prevent the chances of cavities. It only takes a few minutes. So doing correct chiropractic actually doesn't take that long, 5 to 10 minutes.
Are your procedures usually lying down?
Yes, you get in different positions depending on the area. For example, with your neck, you're supine, your face up. When you're adjusting your lower back, you're going to be put in certain side positions. So it depends, but
it's often
you're moving around.
You're moving around. But do you have standing up treatments, for example?
No.
Usually on a bed.
Certainly we can adjust people seated. We can adjust people standing, but I do most of my adjustments on the chiropractic table.
How do you pull the bone? How do you manipulate the...
No, we don't pull the spine. There's some old methodologies that do kind of a yank on the spine. I don't do that. So what we do is just find the joints that are not moving properly, and we bring the joint to a certain tension. Okay, so we laterally flex, or we put their spine in a certain position, and then we just gently adjust the joint with our hands. And the key is the speed in your hands. So if you're slow, then it might not be as effective, or if you don't have as much force, well, it might not be as effective. So that's why every chiropractic adjustment, every chiropractor is different. How a person adjusts is very different.
So you align the bone with your hand. Basically, that's what...
With my hands.
That is what a chiropractor does.
Yes.
And the pressure varies depending on the need.
The person,
the type of
the need, the joint,
the disease or the problem of the patient.
And that's where expertise and experience comes into play with the chiropractor. You know, a chiropractor with a lot of experience adjusts a lot differently than somebody fresh out of school.
I know.
You know.
Just as in the doctor.
Yeah, a doctor that's done surgery for 10 years, then a person fresh out of school that's a little shaky. That's scary, right?
We'll pause again and then we'll go back.
This is 8 TV.
Guys, malilibre ako! Anong choice nyo?
Choose mo to! Choose mo to!
Zesto Fruit Soda?
Refreshingly fruity because it's the only fruit soda made with real fruit juices of Dalandan, Calamansi, and Pomelo. Gawa para sa panlasang Pinoy. Kaya choose mo to!
Guys, manilibre ako! Anong choice nyo?
Zesto Fruit Soda! Choose mo to! Zesto Fruit Soda! Choose mo to!
Ang dami ng peke sa world. Unfair. Pati ba naman puti mo? Peke din? Para totoong puti, mag-Myra Vita White Moisturizer. May vitamin E at natural plant extracts to help nourish skin for that healthy white glow. May double sunscreen na, non-sticky pa. Ito ang totoong healthy white glow. From Myra Vita White Moisturizer. Yan ang alagang holistic.
Trusted quality healthcare. Unilab yan.
A longtime news anchor and commentator, a much respected TV host, a multi-awarded Filipino broadcaster, twice hailed as Radio Broadcast Journalist of the Year, an acknowledged leader of the radio and TV industries, a legendary figure in broadcasting for the past 4 decades. This year's recipient of the Achievement Award for Excellence in Broadcasting, the man with a distinct voice and unparalleled integrity, the one and only Ray Lamy.
MPC, thank you so much. Maraming spending partner sa ating show sa Sanggabon Langit, may isa. Si JR Langit po ang nagpapatuloy sa naging commitment niya ng iniwanan po ng ating anak na si Richter. Sa lahat po na gusto pumasok sa ganitong daralan, hindi lang po passion na kinakailangan. We need dedication and commitment. Then you can say you can easily achieve your goal in uplifting the standards of broadcast journalism, leading to the quest of excellence that will help democracy move forward. Maraming salamat.
Simula Lunes, Agosto 1, DZRJ Radyo Bandido. Alas 10 ng umaga, Lunes hanggang Biyernes, ang iyong kasangga, Ray Lani.
Is brought to you by 8 Tri-Media Pro Incorporated. Palagi ka bang stress? Nakaw! Tatanda ka niyan! Tara na! Alamin ang mga napapanahon at tunay na solusyon sa wastong kalusugan. Narito sina Dr. Cecil Katapang at Ryan George dito lang sa Klinika On Air.
So what is important for people to remember is that chiropractic care is safe.
It is safe.
It's safe, especially if done by a seasoned, experienced chiropractor.
Yeah, you definitely want to make sure you're going to a certified chiropractor.
Yeah.
Make sure that they've gone to chiropractic school, have a diploma. Yes.
There's no need to be afraid of being paralyzed.
No.
Because I have this. I have a patient in my clinic, and then she was talking about how a chiropractor relieved her. I don't know. I cannot remember if it's a headache or a backache, low backache. And of course, the other patients she was talking to was apprehensive or skeptic about seeing that chiropractor friend of hers, and but she can vouch for the effectivity of the treatment of the chiropractor. Do you say chiropractor practitioner?
Treatment. She can vouch for the effectiveness of chiropractic care.
Okay.
Yes.
Yeah, but how are you called? Chiropractor
I'm a
doctor?
Doctor of chiropractic. So instead of an MD, we are DC, Doctor of Chiropractic in America. Yeah.
So it's not Doctor of Chiropractic Medicine, because sometimes I see chiropractic medicine. Is that
No, it's just Doctor of Chiropractic.
Okay. So we were saying a while ago, simply by palpating the different joints of the spine, you are able to diagnose a problem.
Misalignment.
Apart from the history taking, of course. And when you see a patient, a patient comes in, you look for things like misalignment of the spine, which you usually identify by simply looking at the patient.
You can tell a lot by a person's posture, how they're just sitting there talking to you. You can tell if a person's neck is going forward, if they're anterior weight bearing. You know, when they lie on the table and I'm doing my palpation, I'm doing my examination, you can tell a lot by their leg length. You can tell a lot if their feet flare in or out. Those are all indicators their pelvis, their sacrum is tilted.
So how do you see if the sacrum is tilted?
Well, if sacrum is tilted, it's going to affect your feet and how they lie. They should lie straight, but oftentimes when we have pelvic and sacral issues, our feet flare in or flare out.
Oh.
Those are all signs.
Pag sinabi na niya, okay, dapa. And then right away, he will see the problem.
And then when it comes to everything else, I mean, I'm obviously palpating every vertebra. There should be a springiness to the vertebra. But
That's
as the joints, when they're out of alignment, they are stuck. And you can feel it. It's very obvious that they're not moving properly. So we need to restore that motion.
I know someone, he got injured from a football game, I think, in the United States. And then, of course, he went to the hospital and was diagnosed with a sprain. And the day after, he went to a chiropractor and he was okay. I was that was fairly recent. Maybe about a month ago, he was telling me about it. So, wow, where did you? I came from the hospital. I had a sprain in my knee, on my knee, and then the day after, I'm on my way to my chiropractor, and the day immediately after, he was okay.
It's very popular in America.
As your wife was saying, after a chiropractic treatment, it's like it's like a bulb, a light bulb that has
you feel alive.
That has what do you
turned on
after a treatment.
Yeah, we oftentimes will say the power is on because we are activating your nerve function. So you actually will get usually pawis, very hot, and start to sweat because
after a treatment,
because we're activating your nervous system instantly. So your body starts to function better, more efficiently. Usually that first treatment, you will sleep very good. Okay, and sleep is so important because that's when your body regenerates. That's when your body heals.
But say for example, my sleeping habits. Say for example, sometimes most people sleep on the side, right side, left side, or flat on bed. So after a chiropractic treatment, what do you think? What do you suggest that you stop sleeping on your right side or left side or what?
No. I mean, there's no way you can live this
that's what I'm saying.
Stress-free life. That's
you cannot change
not realistic.
your ways or habits.
Of course, making small changes, being aware of your posture, sleeping habits, those things help. So sleep on your back, sleep on your side. If you always sleep on one side, try to sleep on the other side. Those small things will help, but they're not the answer to everything. You need chiropractic care.
So, if for example, I maintain that habit, if I maintain that sleeping habit of sleeping on one side, and then I go for chiropractic care, will that not lend the treatment useless or
no
of no value because
no,
I do not change my habits or my ways?
No, because you need. It's just like, okay, if I go to the gym and then I kind of eat poorly that night, does that mean I shouldn't go to the gym? No, you still should go to the gym, and you still you go to a chiropractor and so you can wear high heels, so you can carry a bag on the shoulder, so you can live life. So I keep people living their life, their quality of life, whether you like to snow ski or
I have
skydive.
A question, by the way. I know that this is probably not, bunions. Because that's a big problem of females, especially because we cannot wear heels.
Yeah.
Is there a way that chiropractor can do something
because
about
that's oftentimes from your feet squeezing into tight shoes. Not probably going to help.
That's
with
an overgrowth of the. So it does not.
Lumaki na.
Baka pwede kasi, di ba?
Kailangan na nun dong lagari.
Because this new treatment for bunions, where you use a silicone thing where you that you insert between the big toe and the second toe it's basically alignment also of the joint of the big toe with the carpal bone or metacarpal bone, so that when it's aligned, you lose the bunion, but you have a very big space between the big toe and the second toe. Have you seen that?
Yeah, syempre, I've seen bunions before, but
no, I mean like the treatment.
I've seen that. Yeah, but chiropractic is not gonna probably help.
Because
with that.
Since chiropractic is about alignment, I was thinking maybe.
We can't adjust any joint. We can adjust elbows and knees, and we can adjust tarsal bones, carpal bones, toes. And some chiropractors might focus on bunions or toes. I personally
you
don't.
think some chiropractors might
maybe
be able to address bunions?
Siguro.
Okay.
There are some chiropractors in the States that have a big animal practice. They take care of horses and dogs and cats.
Yeah.
Big business with horses.
So that means, but then that means like they have to take a vet man because anatomy is different.
Yeah, I mean, there are licenses.
How can you palpate the spine of a horse?
I don't adjust animals.
With such a big
I'm telling you though, it's actually amazing stories. We've gone, because people come and speak to us during schooling, and we've had chiros that treat horses, have amazing stories about horses that get headaches and they're lethargy, they're not functioning right. And I'm telling you, because you can get a horse to run faster for a horse racing. I'm telling you, it's actually quite popular in Southern California. They have a lot of money.
Yeah. Usually rich people
because
din talaga.
animals have nervous systems too, so they can actually not feel well as well. So
And
anyway,
maybe one leg is also shorter than the other.
maybe.
By the way, speaking of your sleeping habits, Dr. Rob create this pillow. Right now, yeah, we have a pillow.
We're excited
It's
about
here.
this.
I want to share this thing to you.
It's
I want you to use this. This is for you.
My
Oh,
goal
thank
with this
you.
pillow was to create a pillow that is going to help support your neck while you sleep. So it does have memory foam in it, but it's also quite comfortable. So I wanted to create a pillow that people are going to continue using, and not just use it for a month and then throw it off to the side. This is a very, very comfortable pillow, but it's also going to support the neck while you sleep.
And what support the neck while you sleep? How?
Well, there are very, very popular pillows out, like the
It is
Tempur-Pedic.
not too soft. It is not too hard.
It's
And it is
There's like a memory.
So I wanted to create a pillow that's good for the neck, and so there are good pillows out there. Tempur-Pedic is one. I think it costs 6,000 to 7,000 pesos.
So this is cheaper.
This is
Yes.
2,500.
Cheaper.
Yeah.
Affordable.
Very affordable,
And it's
very
available where?
comfortable. We can mail it, or it is at my clinic as well.
Yeah, right now.
Yeah, so I can give our phone number. I can give email
sure.
address.
And the size is only
We
one
do have
size?
3 sizes. We have a large, which is queen size. That's predominantly for males. That is 2.5. It depends on what you like. If you like a bigger pillow or smaller, we have this one, which is the red. This is the standard pillow. This is 2,000. And then we have one for children, because it all starts as when we're young. We have a children's that's 1.5.
So that should be your advocacy. You what children meaning how old?
Well, the pillow for children is best for like 6, 5 and up. Obviously, infants shouldn't have a pillow.
You
at that
should
point.
promote that to pediatricians. Get
Yeah. That's why we're.
Yeah, because
on a
we're
mission.
here.
get a med rep to cover pediatricians all over the country, or maybe you can do a talk among pediatricians. Mag-usap tayo.
Okay, Doc.
Sige.
And then this is manufactured by Uratex.
I collaborated with Urtex, and we designed this. Yeah.
Oh, so Uratex is marketing it, or you're
No,
the one
just me.
Right
Just
now,
me.
sa clinic muna namin. And then
Maybe in the future, Urtex will
online.
market.
Yan.
Ay, online.
Online, yeah.
I was thinking maybe you can get distributors all for Luzon, Visayas, and Mindanao.
That's the goal. Yeah,
Yeah,
we
so
would
that
like for this to go
more
global.
people will learn about it,
Yeah.
and more children will be able to prevent any potential diseases brought about by misalignment of the spine, which is
Yes.
quite a number,
You said
like
it right.
allergies,
Yeah.
you said.
Asthma.
Asthma.
Ear
Ear
infection.
Ear infection.
Yeah. So even as
Posture.
kids. Yeah. The
Okay,
posture.
di ba?
Yes.
Excited eh.
Yeah, kasi karamihan po kasi sa atin, minsan bumibili lang tayo ng unan eh. Basta lang malambot, di ba? Hindi natin alam, we sleep kasi, di ba, from 6 to 8 hours. Parang we spend more time in our bed and pillow. So, dapat we need to, buy a better quality of pillow and bed.
It's a good investment. Yeah.
It is. And more people actually are being are getting aware of the value of the alignment of the neck. And they are now realizing that misalignment of the neck actually causes a lot of problems, including shoulder pain,
Headache.
numbness of the arms as well, right? Because even back pains, right?
Yeah.
So which means to say more and more people now are actually aware of the value of using keeping the alignment of the spine, especially with Facebook. They even have illustrations of the neck, the spine, the neck, the body, lying on the pillow, proper pillow.
Having proper mattress, all of that is so important. Yeah.
Ako nga, Doctor, before I met Dr. Rob, I have a problem with my neck. And I always have headache. So before, I always, taking something para lang mawala yung headache ko. And then, yun nga, may nag-ano sa akin na, why don't you try chiropractor? So dito sa Philippines, meron nga si Dr. Camara. Siya yung pinaka-president ng Chiropractic Association here. And then, nung pumunta akong US, I have a friend who married a chiropractor. Tapos, biglang narinig ko chiropractor na ano kagad ako. Syempre, kasi yung chiropractor ko dito sabi, kailangan mo ng mahabang treatment. Ang mahal. Ang mahal nun. Kasi siya lang yata nung time na yun eh.
Yung asawa niya chiropractor.
Oo. Tapos, friend niya yung si Dr. Rob. And then, at that time, sabi ko, aba, chiropractor to sabi ko ganun. And nagkataon naman, the night na yun, in-invite niya akong lumabas.
So, nagpa-treat ka rin?
Hindi pa. Parang lumabas muna kami. Tapos, following day, niyaya niya ako na mag-coffee. Tapos, niyaya ako sa office niya, sa clinic, San Diego. And then, at that time, yun, in-adjust niya yung neck ko, yung back ko. The only time, ang masasabi ko lang, pagtayo ko dun sa bed, para akong lumulutang. Yun yung pakiramdam ko.
Pero hindi mo nakakahilo.
No, I don't feel
parang
hilo. Sobrang gaan. Tapos narinig mo yung mga crack or yung crack na yun, parang ano lang pala yun, popping air. Yun lang yun.
Cracking the bone.
Mm-hmm.
We're not actually cracking the bone. The popping that you hear is air, that's accumulating in the joint. So when I move the joint, it's the
pag
air.
na-release yung air, yun pala yun, that's why you feel so good. Tapos yun, sabi ko na lang, Lord, ito na ba? Ito ba yun? Kaya yun, iniwan ng career sa Pilipinas.
So for a while, you practiced in the States. Doon ka na rin nakatira.
Yes,
and then,
I lived there for almost 13 years.
So you were able to convince him to practice here?
Yes.
Because there's very few chiropractors in the Philippines.
Ang nangyari lang, Doc, we've been here for 2 years now.
So you only been
I sold my practice in America.
Yeah.
And we just came, I didn't come here to practice. I came here we came here for the experience, the kids to see the Philippines, and so I didn't really come here to actually practice.
And back in my career.
Yeah.
So, nung pagdating namin dito, we're doing parang a wellness mission.
Yeah, we started off going just to churches every Sunday, speaking to churches and doing
wellness
more charity,
meaning
chiropractic charity. Yeah, so we started doing that and evolved to, I was going to then gyms and CrossFit gyms and speaking and adjusting. And then people wanted to come to my house, like they wanted to continue to see me. And so then people were lining up outside of my house to get adjusted.
Yeah.
And so that's how it evolved into, okay, well, we better start a real clinic here. The demand is so large.
It is, because there's very few chiropractors practicing in the Philippines. Where is your, I know where it is, but you might want to announce where
it is. We are at, go ahead and...
Pause Building, 305, Tomas Morato, corner Scout Madrinian, South Triangle, Quezon City. Ang the best look po niya is
across from El Terrazo.
What floor?
Second floor.
Second floor. Across po siya ng El Terrazo, sa likod ng clinic ni Dr. Rabi. Yun. Ano man na yun.
The best way to get a hold of us is through a phone number.
If I can give
that.
Phone number?
0905-444-8172.
You have a Facebook page, right?
0905-444-8172. So you can text or call, and my assistant will send you the details of pricing, schedule, and address instantly.
Yeah. So you're by appointment?
Mm-hmm.
Yes, we have certain clinic hours. Yes.
You're gonna just walk in. I mean, like, for example, I feel something really bad. I want to go see your doctor.
You can, but we prefer to have a schedule. That way we know who's coming. Yeah.
Okay. But are you there every day?
No. Tuesday, Thursday, Saturday, and Sunday.
Ano lang siya, sa weekdays, 2 times lang siya.
Kasi Monday, Wednesday, Friday. Go ahead.
Kasi Saturday and Sunday, that's the time mayroon siyang clinic. Kasi sabi niya, traffic kasi parade. Sabi niya, kasi marami siyang mga patient from other
other places, far away.
Alam mo nga, sometimes talaga, sobrang kami, na-appreciate namin yung mga patient. Galing pa sa Bacolod, galing pa sa Baguio, para lang makita si Doc.
Talaga.
Papanga.
Cavite.
And they
Isabela.
probably are referred by those whom you've treated and improve as well.
Yeah,
Oh,
so
parang word
everyone
of
is referred
mouth.
to.
Oo, nga.
It's
Diba?
like spreading.
When somebody has been treated by him and then they started to experience improvement.
The whole
whatever
family
they
comes. So we've got the whole family, all the kids, husband, wife,
Yeah, through
lolo,
social
lola.
media din. Kasi 'di ba, pag nakita nila, "Oy, saan 'yan?" No, 'di ba?
Dr. Rob, thank you very much for coming.
You're welcome. Thank you so much for having
spending some
us.
time with us today.
Siyempre.
Di ba nag-clinic ka pa kanina?
Oo, galing pa yan sa
Oo,
clinic.
Sabi ko, wala pa si Doc Rob.
Oh, thank you.
Thank you very
Doc,
much, Miss Patricia.
Kadapay.
Thank you.
Opo, sobrang po ito. We really appreciate na nakapag-guest po kami sa show nyo para po to spread the word of chiropractic.
And to let the people know that you have a clinic here and chiropractic medicine practice is safe.
Very safe. And last thing, if you do want a pillow, you can text that number I gave as well, and we can also set up arrangement for the pillow.
Oh, yes.
Yes. 0905-444-8172.
Yes.
Thank you very much.
Thank you.
Doc.
Thank you.
810 DZRJ AM Radio Bandido. This is 8 Try TV.